Only a few viruses in history have been as stigmatized as the human immunodeficiency virus, or HIV. While much progress has been made since the epidemic began in 1981, some negative stigma continues to shroud the illness. These feelings still persist today, despite the fact that it affects nearly 1.2 million Americans, according to the CDC. Though once thought to be a fatal disease, treatment has evolved significantly, and life expectancy has dramatically increased.
HIV is no longer a death sentence. People still seem to think that HIV can be transferred through kissing, through using the bathroom. And we just want to remind people that that's not true. It is a sexually transmitted infection. As well, people don't know the difference between HIV and AIDS. They think that AIDS is the virus and that once you get AIDS, you can no longer live a healthy lifestyle, which is also not true.
That's Joey Garcia, a peer support specialist for people living with HIV. He says that despite advancements in treatment, there are still barriers to accessing HIV care. In addition to harmful misconceptions about the virus, many areas still lack the resources to provide adequate treatment to those in need. According to HIV.gov, this lack of care is one of the primary causes for why the HIV epidemic continues to this day.
We are in year 41 since it was initially diagnosed in 1981, and we have come a long way. We have come a significant way from both in terms of those who have been diagnosed with HIV living much longer to the overall rates of HIV coming significantly down. But we're not there. We have not ended HIV, and so there's still work to be done. There are still disparities among certain populations to be addressed.
That's Dr. Timothy Harrison, a deputy director in the Office of Infectious Diseases and HIV/AIDS Policy at the Department of Health and Human Services. He says HIV outbreaks are most severe in areas without vital resources. These include preventive medications, syringe service programming, and most importantly, access to antiretroviral therapies. Antiretroviral drugs reduce the amount of HIV in the body through viral suppression.
Viral suppression is a measure of the amount of virus in your blood, HIV virus in blood, so at such a low level that it is not allowing HIV-related illness to develop. And it's a level where most of our standard instruments and labs do not detect it. And so it is the standard by which we want to all folks living with HIV to achieve, because it helps them to sustain their life, a healthy life. But it also has a related public health benefit. The science is showing that those who achieve viral suppression and maintain that using the medications are unable to transmit that virus through sex to sexual partners. So it's a double benefit, first and foremost for the person living with HIV, but then it has also this other public health benefit.
In addition to protecting sexual partners, antiretroviral therapy can also help pregnant women.
As far as you no longer being able to pass that virus on to somebody else, you also can't pass it on to your children, which is great. What we're noticing is mothers who are living with HIV, if they're taking their medication and they're also virally suppressed, they have a higher chance of not passing on that virus to their little one as well.
According to Harrison, treatment for HIV, as well as patients' quality of life, has greatly improved over the past 2 decades. Prior to antiretroviral therapy, HIV medications were not nearly as effective. They were highly toxic to patients' bone marrow and difficult to manage. Individuals were often required to take a cocktail of drugs in order to remain healthy. Today, people with HIV can maintain viral suppression with just 1 pill a day. So why are some still hesitant to seek treatment?
There's a variety of reasons why somebody might not take their medication. One of the biggest ones is just stigma. They don't want people to know they have HIV, so they won't take their HIV medication, or they won't go to the doctors because they don't want to be seen at a doctor's office that specializes in HIV care. Another is just the fact that they might be homeless and not have access to those resources. And the biggest one is just resources, the awareness, the lack of awareness to these resources. And most people seem to think that HIV medication is $8,000 and they can't pay for it. And they don't know that there are state programs that would help pay for that medication. And if you're going to a regular primary care provider who's not specialized in HIV or infectious diseases, they might not have those resources available right away, and they might not know to tell you right away as well. And there's even a hotline that you can use to get that information.
To combat some of the problems Garcia outlined, the Office of Infectious Diseases and HIV/AIDS policy has implemented the I Am a Work of Art campaign. This campaign encourages people with HIV to seek care and remain in care with the end goal of achieving viral suppression.
Our focus is really on those individuals who may have been diagnosed with HIV but are not in regular care. Either they were never in regular care, or they may have fallen out or cycled back and forth because of a variety of different reasons. I think one of the reasons we're initiating a campaign like this is to raise awareness that we are not there yet, and there's more work to be done, but we can do it. And so I think that's sort of in a nutshell where we are here today.
The campaign works hand in hand with an initiative called Ending the HIV Epidemic in the U.S., which launched in 2019. To date, the program has provided aid to more than 100 cities across America.
The Ending the HIV Epidemic is a health equity initiative to address those jurisdictions that have substantial burden of HIV by giving them additional resources. And all of this was with the idea of ending the HIV epidemic by 2030.
While HIV is no longer the death sentence it was believed to be, Harrison and Garcia explain that it's still a critical health issue. But with proper care and access to essential services, people with HIV can live long, healthy lives. To find HIV care in your area, Garcia recommends calling your state hotline, which can be found at hrsa.gov. For more information about the I Am a Work of Art campaign, visit hiv.gov/ART. You can find more information about Dr. Timothy Harrison, Joey Garcia, and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Twitter, and Instagram. Our associate producer this week is Grace Galanti. Our production manager is Jason Dickey. I'm Nancy Benson. Coming up next week on Radio Health Journal.
Most people don't realize that's not that big of a step away from sci-fi. It's a little closer to reality, but we use the same sort of sci-fi mentality.
How e-tattoos can diagnose an illness.
Then why cancer patients are more at risk for fatal heart disease.
A lot of times when the battle has been won with their cancer treatment and they've been in prolonged remission, we're actually finding that they die of accelerated cardiovascular disease.
All that and more on Radio Health Journal. I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
All of these places, they end up on lists that the media makes, like clickbait kind of lists of the most miserable places to live in America.
The towns and cities across America that have been left in the dust. Then,
I do think there has been real movement that we just didn't see before the summer of 2020.
What real progress, if any, has been made since George Floyd's death? I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
And that's Radio Health Journal for this week. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.